Introduction. Medical nanotechnology has revolutionized the field of medicine by offering targeted drug delivery systems and improving therapeutic outcomes. In this detailed script, we will explore various topics related to medical nanotechnology, focusing on the applications and advancements in renal drug delivery. Understanding the intricate microcirculation of the kidneys, renal targeting strategies, drug release kinetics, and nanoparticle surface modifications are critical for developing efficient and targeted therapies. Additionally, we will delve into the emerging field of nanotheranostics for kidney cancer, the importance of renal nanotoxicology, stimulus-responsive nanoparticles for renal drug delivery, magnetic nanoparticles for kidney-targeted hyperthermia, biomimetic nanosystems for kidney regeneration, and the potential of acoustic nanosystems. Through this script, we will gain a comprehensive understanding of the role of medical nanotechnology in improving kidney-related treatments. Renal microcirculation plays a crucial role in maintaining kidney function. It consists of a complex network of blood vessels and capillaries that support the exchange of nutrients, waste products, and drugs in the kidneys. Understanding the renal microcirculation is essential for designing effective drug delivery systems. The unique architecture of the kidneys, including the glomerular filtration barrier and peritubular capillaries, presents challenges for drug penetration. However, nanotechnology offers novel solutions by exploiting the size-dependent behaviors of nanoparticles. Engineered nanoparticles can be designed to selectively target specific renal cells, allowing for precise drug delivery. By leveraging the intricate knowledge of renal microcirculation, medical nanotechnology has the potential to revolutionize the treatment of kidney-related diseases. Developing effective renal targeting strategies is crucial for improving drug delivery to the kidneys. Nanotechnology provides innovative approaches to overcome the challenges associated with drug delivery to renal cells. One such strategy involves surface modification of nanoparticles with ligands that can specifically recognize and bind to receptors on renal cells. Selective targeting ensures that the drug is delivered directly to the intended site, reducing off-target effects and improving therapeutic efficacy. Additionally, stimuli-responsive nanoparticles can be designed to release drugs in response to specific cues within the renal microenvironment. These targeted strategies allow for enhanced drug accumulation in the kidneys while minimizing systemic exposure, leading to improved treatment outcomes. The renal barrier penetration is a critical factor in the successful delivery of therapeutics to the kidneys. Nanotechnology offers innovative approaches to engineer nanoparticles that can overcome the barriers present in the kidney, such as the glomerular filtration barrier and the renal tubular epithelium. Particle size, shape, and surface charge are key factors influencing the renal barrier penetration. Nanoparticles can be engineered with specific physicochemical properties to enhance their ability to cross these barriers. Surface modifications, such as the addition of stealth coatings, can prevent opsonization and reduce clearance by the immune system, thereby prolonging nanoparticle circulation time. By engineering nanoparticles to efficiently penetrate renal barriers, medical nanotechnology holds great promise in improving the delivery of therapeutic agents to the kidneys. Controlled and sustained drug release is critical for therapeutic success. Medical nanotechnology provides unique opportunities to design nanoparticles with precise drug release kinetics. By encapsulating drugs within nanoparticles, release profiles can be tailored to match therapeutic needs. Factors such as the nanoparticle composition, size, and core shell structure can influence drug release kinetics. Stimuli-responsive nanoparticles, which release drugs in response to specific triggers such as pH, temperature, or enzyme activity, further enhance control over drug release. These innovative drug delivery systems offer the potential for prolonged drug action, reduced dosage frequency, and improved patient compliance. Understanding drug release kinetics in the context of nanotechnology is essential for optimizing treatment efficacy in kidney-related diseases. Surface modification of nanoparticles is a key strategy to enhance their stability, biocompatibility, and targeting abilities. Through surface modifications, nanoparticles can acquire specific functionalities and interact favorably with renal cells. Coating nanoparticles with biocompatible polymers, such as polyethylene glycol, PEG, can prevent recognition by the immune system and improve their circulation time. Ligands, antibodies, or peptides can also be attached to nanoparticle surfaces to enhance renal cell targeting. Additionally, surface modifications can facilitate the attachment of imaging agents, enabling non-invasive monitoring of drug distribution and therapeutic response. Nanoparticle surface modification techniques are vital for maximizing the potential of medical nanotechnology and renal drug delivery. Intraperitoneal drug delivery to the kidney is an emerging approach that offers several advantages over traditional routes. This technique involves the administration of drugs directly into the peritoneal cavity, allowing for efficient drug absorption and subsequent distribution to the kidneys. Nanoparticles can be engineered to encapsulate drugs and selectively release them within the peritoneal cavity, facilitating renal targeting. The large surface area of the peritoneum provides ample opportunities for drug absorption, increasing therapeutic efficiency. By harnessing the potential of intraperitoneal drug delivery, medical nanotechnology offers a promising avenue to deliver therapeutics to the kidneys effectively. Nanotheranostics, an emerging field at the intersection of nanotechnology and diagnostics, holds great promise for kidney cancer treatment. Nanoparticles can serve as both therapeutic agents and imaging probes, enabling simultaneous diagnosis and treatment. Nanotheranostic platforms can be designed to specifically target cancer cells, delivering therapeutic agents directly to the tumor site and minimizing systemic side effects. These nanoparticles can also carry imaging agents, facilitating real-time monitoring of treatment response. By integrating diagnostics and therapeutics into a single system, nanotheranostics have the potential to revolutionize kidney cancer treatment by improving precision, efficacy, and patient outcomes. As medical nanotechnology advances, understanding the potential toxic effects of nanoparticles on renal cells and tissues becomes crucial. Renal nanotoxicology aims to assess the safety and potential risks associated with the use of nanoparticles in kidney-related therapies. Factors such as nanoparticle size, surface charge, composition, and clearance pathways influence their toxicity. Rigorous studies evaluating nanoparticle biodistribution, cellular uptake, and long-term effects on renal function are essential to ensure patient safety. By comprehensively understanding renal nanotoxicology, researchers and clinicians can develop safe and effective nanotherapeutics for kidney-related diseases. Stimulus-responsive nanoparticles are designed to release drugs in response to specific cues present in the renal microenvironment. By incorporating stimuli-responsive components such as pH-sensitive polymers, temperature-sensitive materials, or enzyme-sensitive cleavable linkers, these nanoparticles can release drugs at the target site, increasing treatment efficiency. For instance, pH-sensitive nanoparticles can exploit the acidic environment present in certain renal compartments to trigger drug release selectively. Stimulus-responsive nanoparticles provide an innovative approach to site-specific drug delivery, minimizing off-target effects and improving therapeutic outcomes. Magnetic nanoparticles offer unique properties that can be exploited for kidney-targeted hyperthermia, a therapeutic strategy for kidney-related diseases. These nanoparticles can generate heat when exposed to a magnetic field, facilitating localized hyperthermia treatment. By encapsulating magnetic nanoparticles within a carrier system, they can be guided to the desired renal site using an external magnetic field. Once accumulated in the targeted area, the nanoparticles can be activated to induce hyperthermia, which can selectively destroy tumor cells or treat specific kidney conditions. Magnetic nanoparticles hold immense potential in improving the efficacy of hyperthermia treatments while minimizing damage to healthy renal tissue. Kidney regeneration remains a significant challenge in the field of medicine. Biomimetic nanosystems offer a promising approach to regenerating damaged renal tissue. These nanosystems mimic the natural extracellular matrix of the kidneys, providing a supportive environment for the attachment, proliferation, and differentiation of renal cells. By incorporating growth factors, scaffolds, and signaling molecules, biomimetic nanosystems can guide the regeneration process, promoting the formation of functional kidney tissue. The ability of nanosystems to interface with biological systems at the nanoscale level holds immense potential in developing effective regenerative therapies for kidney-related disorders. Acoustic nanosystems represent an innovative approach in renal drug delivery. These systems utilize sound waves to promote drug release and enhance tissue penetration, minimizing invasive procedures. Acoustic nanoparticles can be engineered to respond to ultrasound stimulus, allowing for the spatial and temporal control of drug release in the kidneys. The application of focused ultrasound can further enhance tissue penetration, enhancing drug distribution throughout the renal tissue. Acoustic nanosystems offer a non-invasive and targeted drug delivery strategy for various kidney-related diseases, showing promise in improving treatment outcomes while minimizing side effects. In conclusion, medical nanotechnology has immense potential in improving renal drug delivery and revolutionizing treatments for kidney-related diseases. Through understanding and utilizing the intricate renal microcirculation, developing renal targeting strategies, engineering nanoparticles to penetrate renal barriers, optimizing drug release kinetics, modifying nanoparticle surfaces, exploring intraperitoneal drug delivery, and advancing nanotheranostics, renal drug delivery can be enhanced. Addressing renal nanotoxicology concerns, developing stimulus-responsive nanoparticles, employing magnetic nanoparticles for kidney-targeted hyperthermia, utilizing biomimetic nanosystems for kidney regeneration, and exploring acoustic nanosystems further expand the scope of medical nanotechnology and kidney-related therapies. By harnessing the power of nanotechnology, we can strive for improved patient outcomes, reduce side effects, and a brighter future in the realm of renal medicine.